This video is not brought to you by Zevia, even though I like them. And I hope you tolerated whatever commercials were right before this. So enjoy the video. You know, Dan, I think it's good to talk about and to think about death. I think it's healthy to think about our mortality, to know that our time is limited, to know that our time is precious. And what better article to talk about today than this article from 2007, Immunity and Aging. A lot of the data in here is over 20 years old. This podcast is going to be about omega-6 fatty acids, polyunsaturated fats, seed oils, and everything from the food industry, and how a lot of the information that's coming to you, listeners, from the medical industry is probably wrong. We're gonna dive right into why. So
we're not ready for this one. Dr. Joe came prepared.
Well, is the world ready? Okay, so this is a great article, by the way. So for the clinical folks, the biochemists, this is a wonderful research article. Well, no, it's a wonderful review article on biochemistry, and it goes into bisphosphonates, polyphenols, statins even, and their role in osteoporosis and aging. So interleukin-6 and tumor necrosis factor alpha are stronger predictors of cardiovascular disease than C-reactive protein. But we check CRP, C-reactive protein. We check it all the time.
Right.
Now,
did on a patient on a study.
Now, Dan, I gotta ask you: have you ever checked interleukin-6 on people?
Nope.
Is it an expensive assay?
I would not want to find out.
I mean, I didn't research that. I think it's probably an expensive assay. That might be why we don't check it on people.
It's for sure a specialty order and not a routine.
Yeah.
And why? Because let's break it down real quick. Well, I'm glad I'm here for this.
Yeah. You like interleukin-6 discussions.
I love it. I see it. So the way I learn, and I'm not even a pre-med. I'm a pre-med dropout. All right. I did graduate. I was pre-med, but I never got close to med school. Mm-hmm. I took the MCAT and never got close. But interleukin-6, this comes up all the time. Whether it's atopic derm, whether it's hypercholesterolemia, whether it's oncology, obesity, the studies that I do, I don't think it came up in depression, but who knows? Alzheimer's, neurocognitive, the
Aging.
4 horsemen of death, right? Is cardiovascular disease, neurodegenerative disease, cancer, and what's the fourth one? Metabolic disease.
Metabolic disorder, yeah.
So that's got to be involved in all of those.
So interleukin-6 is associated with accelerated aging if it's in a higher proportion, or if people have a polymorphism where they react to it more. And interleukin-10 is associated with living longer and centenarians. A lot of centenarians are found to have higher interleukin-10. They just have more of it sitting around.
But they both respond to inflammation, no?
Yeah. All the interleukins are considered to be some sort of an immune response, inflammatory response, part of that pathway. But don't confuse interleukin-6 with omega-6. We're gonna get there.
People will do that.
Because they both have the 6 in them. But interleukin-6. We've known this stuff about interleukin-6 for over 20 years, okay? Beneficial effects of omega-3s versus corn oil, okay? The short of it is bone mineral density was correlated with an increased, rank L expression. It's an acronym, which is a genetic thing. So basically, bone mineral density went down in the animals that were consuming an excessive amount of corn oil. And it did not happen in the mice that were having the omega-3s. So again, this is a great review article, you know, and this guy talks about the
So you're saying the omega-3s
aging.
do not have the stimulatory
they don't
effects
have the
on-
osteoporotic effect of omega-6s.
And that's because they don't trigger a interleukin-6 response as frequently? Or?
That connection, I don't think that connection was made here. It's
Right.
either interleukin-6 or TNF alpha or something.
TNF alpha, because that's the other one I see everywhere.
And
How do these relate? IL-6 and TNF alpha.
they're both pointing in one direction, which is more inflammation.
So it's signaling to the body, hey, danger.
Danger, danger, danger.
Let's bring cytokines.
Let's bring immune cells. Let's start a fight. Let's start damaging things.
Because in cancer, TNF alpha comes up all the time.
Yeah. So, I think the alternative is, interferon gamma. That's another one too. But that wasn't brought up in any of these articles that I saw. Okay. Now, another really great article is omega-3s and omega-6s. This is an article from 2011. And it was the impact of omega-3s to omega-6 polyunsaturated fatty acid ratio on cytokine release in human alveolar cells. Okay, this is over 10 years ago. So
Cytokine release.
cytokine release. So you're talking about inflammatory response when somebody gets a really bad pneumonia, bad infection. And that's particularly prevalent given the pandemic.
Yeah, I was
Okay.
just going to say.
And cytokine storm. But in this case, the short of this one was if subjects had a ratio of 1:1 or 1:2 of omega-3s to omega-6, then they did not have a big inflammatory response. They did not have excessive cytokine release. But when you went up to ratio of 1:4, 1:7, a larger proportion of omega-6, then you get a lot more inflammatory damage with an inflammatory stimulus. That was basically what this paper was. And, persistently elevated levels of pro-inflammatory cytokines associated with decreased production of anti-inflammatory cytokines correlate with severity of lung injury. The degree of cytokine imbalance leads to additional non-pulmonary organ dysfunction and increased mortality rates in ARDS patients. ARDS, you've heard of ARDS, acute respiratory distress syndrome.
That became popular during COVID. And
Yeah. So you diagnose ARDS with often clinically with an X-ray, with a blood gas, with just how the patient looks.
Right.
You have to make decisions.
So you're saying, like, just as a complete layperson almost, the cytokine storm we saw after infection like COVID, right?
Yeah, and it doesn't have to be COVID. It could be any pneumonia.
Anything
Yeah.
in the lungs. Are we seeing a similar thing happening because of the diet we're having in other organ systems? Same kind of response?
I didn't find any papers on the cytokine release in other organ systems.
Okay.
But typically cytokines can overflow and leak into other organ systems. That's certainly possible.
Okay.
But this is important because what you folks need to take away from this is that you invest in your health. You invest in your health by paying attention to things like this, by understanding that the food industry does not understand this, and the food industry is not interested in healthcare outcomes. They're interested in making money.
Of course.
And that's just kind of the way it is right now.
So the ratio of 3 to 6,
So-
you need to have a solid omega-3s. The more 6s you ingest, the more omega-3s you need to have.
Exactly. And all these academic institutions will say you can have a little bit, but do they actually come out and give you a clear example of what you should do?
No.
Rarely, if ever. And then there's dietitians on academic websites that are saying that margarine's good for you. Okay, we're going to talk about margarine, folks. We're going to talk about margarine in a little bit.
I'm a fan of Kerrygold grass-fed butter.
Kerrygold, it's a good brand, especially like the whipped, like the softened up. Oh yeah, that's great.
Would that be omega-3?
Depends. Depends on what the cows were fed.
Grass-fed.
If it's 100% grass-fed, then there should be a good amount of omega-3s in
They
there.
play games with that too.
Yeah, so this is another big problem. This is where we have scientism versus actual, we could say godly science, like a science that can be trusted because we have this devotion to a principle, not, just make this study look good so that we can sell more.
Right.
And you have a whole bunch of research saying that meat's bad for you. You have a ton of research now saying that. But what that research is not controlled for is what the animals were fed. So you can choose to have fish that were raised with pellets in some farm somewhere, or you could have fish that were wild caught up north.
Right.
You could have beef where the cows were kept inside of these little containers and they were fed corn all day long.
Right.
Versus you could eat beef of cows that were grazing and ate grass right up until the moment that they were slaughtered for their meat.
But you know what? Like to make not to make it even more complex, because I do want to hone in on the concept, like the fundamentals here. It's getting harder to do even that when you've got mercury toxicity in the water now. So even wild caught fish, they're swimming in mercury polluted waters.
Right.
Even grass-fed cows, if I learn anything from you and Esther generation, atrazine sprayed crops, pesticides. So even that is not perfect, or we have no way to guarantee it. But you're saying that's so far ahead, most people are still stuck on just margarine instead of grass-fed.
Well, yeah, and not even margarine. It's like, well, yeah, like fast food's okay every now and then. I mean, fast food's not okay, folks. Like, it's just not okay.
Yeah, Daniel, come on, man, no more fast food. But do you ever have fast food personally?
Have I ever had fast food? Yes. Do I occasionally have fast food? Yes. I try and make the healthiest choice I can, though. If I get a burger, I try and do the lettuce wrap. I actually like
the In-N-Out one is good.
Yeah, the In-N-Out one's good, and In-N-Out, that's an American-owned company.
Yeah.
They're still private. I mean, I think that's a great burger place. And actually, I eat their burgers and I don't get sick. There's not many fast food places I can say that about.
The one they have a onion wrapped one now, which is really good. But
onion wrapped.
Onion wrap. It's called a Dutchman, Flying Dutchman.
Wow.
Yeah, it's like lettuce wrap, but with the onion on the outside.
Wow.
But like, so I was gonna say, when you do indulge in, like, let's say, fast food for a day or something, or like a meal, not a whole day, but a meal, do you do anything to increase your omega-3 that day compared to other days?
There are times when I think about it and I say I need to do something, and I actually have fish oil that I keep in my fridge, and I'll just like mix that with yogurt and like this elderberry syrup to make it more palatable.
Wow.
And I'll mix that up, and it doesn't taste that bad, but it just kind of gives me a bolus of that because
give you like a buffer against the crap that you're knowingly putting.
Yeah, well, because you want to try to reach at least a 1-to-2 ratio, if not a 1-to-1 ratio, of omega-3 to omega-6.
That's the thing that's going to stick with me after this podcast. Is that number you just.
So if people are eating fast food for 3 meals a day, you better be taking fish oil with every single one of those meals, but the best thing to do is to just change your habits.
I see.
But even if you're producing all of your meals at home, if you're cooking with margarine, if you're putting canola oil on things, if you're using any of those other oils, then you're inundating yourself with omega-6, even though it might seem like you're doing healthier things.
And it's really hard to be compliant.
Yeah.
Like, you have to almost go out of your way to find these ingredients.
Mm-hmm.
I mean,
well,
can you get them all at Fry's or Albertsons, or you have to go to Sprouts? And even there, it's like guaranteed.
Well, I haven't looked in a lot of places specifically for these since I started looking into the olive oil thing. And folks, check out our video on olive oil. Okay.
Oh, amazing.
but I've realized that it's almost impossible to get real olive oil unless you live next to an olive oil producer. And that's just the simple fact that no country ever exports its good stuff. Folks, extra virgin cold pressed olive oil means nothing. It's meaningless. It has nothing to do with modern olive oil production at all. If you want to know what olive oil is good, first you have to have the opportunity to taste real olive oil. So if you ever go to Italy, if you ever go to Greece, if you ever go to any of those countries in the Mediterranean.
There's a restaurant here I still want to take you to. We're going to try to do a podcast there.
Oh, yeah. That guy,
Yep.
he kind of canceled last minute, I think.
Yeah.
I think he was busy. But you walk downtown through these places, and you, instead of having shots, like, walking around the strip in Vegas, you're having a different kind of shot. You're taking olive oil shots. And you can taste the difference. You can taste it, that it's like clean. There's like a cleanness about it. And then you know what non-rancid oil tastes like. And then you come back to this country, any oil you get off the shelf and you taste it, I guarantee it's going to taste pungent, weird, strong. So folks, I don't think almost any liquid oil should be bought off the shelf. You should go to an olive oil producer. And in Yuma, we're lucky because we got Desert Olive here.
Yeah. And they have an online store. We get nothing out of it, but
yeah. Actually, if folks who live in Yuma, if you go over there and you mention our podcast, they'll give you a discount.
Yeah,
that's what he told me. But
so bisphosphonates and interleukin-6, can you just kind of...
Bisphosphonates, yeah.
Can you kind of walk us through a little bit of that? Like I see
Yeah,
cortisol's involved.
yeah. So osteoclasts. So the way you remember osteoclasts, osteoblasts cut, osteoblasts build, and bisphosphonates inhibit osteoclast activity. So then they see an improved inflammatory status on bisphosphonates. Well, that makes sense, because if you have osteoclasts, that's something inflammatory. It's eating away. But you need osteoclasts to...
Eating away what? What are they eating?
Sorry, eating away the bones.
I got you.
Osteoclasts live in your bones, and they're the reason why your bones have a good architecture. Because they clip and prune. As the blasts build, the clasts shape it and make it look nice and make it structurally sound.
Like functional,
stable. Yeah, they make it functional. But that's why abnormal fractures, you have a higher risk of abnormal fractures if you're on bisphosphonates for too long. You can get fractures that are kind of different because you have unchecked osteoblast activity, making a less ordered bone structure.
Building less, basically.
Well, it's building more bone, but it's not. But it's more out of order, and it's less. It's less structurally sound.
So the clasts cut. The C is for cut. So they cut into your bone.
Yeah,
Is this like OA of the knee, or is that more from it?
OA is inflammatory. But osteoporosis is like bone mineral loss. It's where the bone just gets more spongy and less full, and then you can get more fractures easily.
So
think of osteoblasts like the mechanic, and the osteoclasts are the engineers. If you don't have engineers, then your mechanics are not going to do their job very well.
So the clasts are like fine tuning it.
Yeah. They're saying nope, get rid of that, and let's just leave that there, and let's do this here. Yeah.
So OA, osteoarthritis.
Completely separate thing, but yeah.
That's inflammation related, you said.
Yeah, but the pain associated with osteoarthritis, I think that's definitely inflammatory. I think osteoarthritis, like the bony changes that you see on X-rays, is related to your activity.
So it's more of a physical.
That's why you look at a farmer's hands. You're like, that's a farmer or a mechanic or a plumber or a construction guy or somebody because they got the hands.
And then rheumatoid arthritis.
Rheumatoid arthritis is definitely inflammatory.
You think that's due to diet as well? Like this, something similar to what we're discussing?
I'm sure it is.
Yeah.
I'm sure it is. And all these chemicals that we talk about in estrogeneration, in that book Estrogeneration by Dr. Anthony J, which
Every
everybody needs to
video
read.
comes back to that.
See,
book.
like, I mean, okay, folks, if there's a video where we don't bring up Anthony J's amazing books,
You win
then,
some olive
then,
oil. We'll
then-
buy you some
then,
and ship it
then
to you.
drop a comment. Well, hey, don't make the promises.
I'll do it. We won't. Every video it's gonna be mentioned.
Well, yeah. I mean, yeah. I don't foresee a video where it doesn't come up. But anyway, so so that's so this article. This is the article I meant to bring up before. Fatty acid intake in relation to reproductive hormones and testicular volume among young healthy men.
Omega-6.
So-
Shrink your testicles.
It shrinks your testicles. So
That was the viral.
209
Sure.
men.
Yeah.
209 men were looked at in this study, and they had a really great set of methods here. They had a questionnaire that went through 101 different foods. They asked them about whether they smoke, exercise, all these lifestyle things. And kind of the bottom line here was that intake of omega-6s was associated with increased luteinizing hormone and inversely related to testicular volume. And then on top of that, we got trans fat that was inversely related to testosterone level and testicular size. So trans fat not only shrinks your testicles, but it also drops your testosterone. And then the omega-3s were associated with a larger testicular volume. And they actually used the same examiner, like the same guy, the same single provider to examine all the test subjects, and you had an orchidometer. So
people are naturally.
so it's a pretty good study. It's a pretty good study.
No, it's an incredibly insightful one. So how would you increase your omega-3? You said it a little bit earlier.
Your omega-3s, for the vegans, algae oil. You can get algae oil, because where do fish get their omega-3s? It's because they ate something green that was in the ocean or in the river. So you got algae, you got seaweed, you got kelp. You have all these green things, and that's why the sun and green things are really what ultimately feed us. It's just we can't get to that. That's why we need to eat the fish, or we need to eat the cows. You have to eat the thing eating the green things.
No, it's like a derivative of, like a backwards derivative of the source.
Yeah. Yeah, and as one of my mentors says, we actually eat sunlight. We're supposed to be eating sunlight. Well, so plants transform sunlight into nutrients, and then something eats the plants, and then we eat the something. So we're eating sunlight. It's kind of a cool idea.
Wow.
But well, I guess you could but you could say omega-6 is sunlight too. So
it's corn.
it doesn't really jive with biochemistry, I guess. Okay.
But it's man-made corn, not natural corn.
Yeah. And then for the religious people out there,
So it still applies.
all the man-made things that we try to replace the natural things with, they're abominations, and they don't work.
And nothing replaces the sun. It's like very spiritual, actually.
Yeah. And that's a great segue into our next video, which stay tuned for, folks. We're going to be interviewing, I don't know what to call her. She's like this.
Holistic.
She's a holistic care personal trainer, health coach,
Amazing.
practitioner.
I'm looking forward to it.
So really looking forward to getting her on here. It's going to be a remote call, but I think that's going to be cool.
People won't even know the difference with Daniel editing.
Yeah.
They'll think she was right here with us.
Yeah. And this last paper, it was DHA alone has been found to reduce inflammation. Yeah, DHA is docosahexaenoic acid, which is just one of the omega-3s. It drops interleukin-6.
Where do you get this from?
What a surprise.
Where do you get that from?
That's one of the fish oils.
Fish oil.
Yeah, docosahexaenoic acid. It
for
comes
people
from fish.
saying, all right, Dr. Joe, like, not a big deal. I'll just go buy some fish oil pills, cod liver oil, and I'm good.
Yeah, but you have to make sure that you're tracking what you're doing. Like, you have to track, how much relative proportion of omega-3s and omega-6, like, what is that proportion?
Can you ever get too much omega-3s in your body?
So that's a good question. I found some articles about too much omega-3, and omega-3 is anti-inflammatory, so you can actually. There was the. I haven't seen it clinically, but this article was talking about too much omega-3 and the risk for intracellular parasitic infections. Like,
so you lower your immunity.
Yeah, so you see tuberculosis taking hold of people who have an overabundance of omega-3.
Yep.
But where do we see overabundance of omega-3 anymore? Like you almost never see it. I mean,
now you just see it in like autoimmune things like psoriasis or the MABs, monoclonal antibodies. Or
maybe it's also the fisherman who eats nothing but fish. Yeah. And they're just eating nothing but fish, and it's like a lanky old guy with a long beard, and he's a fisherman, and he drinks water, and maybe he drinks wine, and he eats fish, and that's what he does, and he's doing okay. But then he doesn't have any omega-6s, so he gets TB. I mean, we don't have a lot of TB in this country, and it might be because of the excessive omega-6. But see, the pendulum is swinging too far in the other direction. We have so much omega-6.
For these four
everybody's overweight.
4 horsemen of death right here.
Everybody's overweight. Everybody's got metabolic syndrome. Well, not everybody, but a majority. So this is why we should think about what humans were meant to do. How were we meant to live? How were we meant to eat? Were we meant to eat these oils that go through multiple stages of chemical and machine processing, and for doctors to come and say that it's good for you? I mean, this is preposterous. You know, I gotta bring up a couple Mayo Clinic articles.
Yeah, get into this chart, this chart looks insane.
This chart is gonna be a nice little finishing touch. Okay, so folks, if you get on the internet, okay, open up another tab. You know, so if you're on your computer, you can hit Control Tab, or no, Control. Yes, is it? Yeah, to open up a new tab, or Control Enter, whatever. So there's a Mayo Clinic article: Healthy Lifestyle, Nutrition, and Healthy Eating. Expert answers butter versus margarine. So let's see what this article says.
Butter versus margarine.
So this is some registered dietitian. Margarine often tops butter when it comes to heart health. Margarine is a blend of oils that are mostly unsaturated fat. Butter is made from cream or milk. So they're talking about, so they start with very basic information. This is just a very layman's article.
So they're saying margarine's good because it's unsaturated fat?
Yeah, they say it's good purely because it's unsaturated, but they don't talk about the ratio. This is supposed to be a registered dietitian working for one of the most prestigious institutions on the planet, and somehow this is allowed to be posted on the internet. So now I'm just saying I disagree with this. I think it's wrong, and I think Mayo should consider changing it.
What's the main?
Replacing saturated fat with unsaturated fat may lower the risk of cardiovascular disease. Now, there's an article, and I didn't get a chance to print this out. Saturated fat decreases stroke risk. Wait a minute. Isn't stroke and heart events, aren't those kind of related? Right? So what about that? Anyway. And what about those studies that we talked about that are probably confounded because of scientism, where we're studying meat that was fed not the best things, and then it shows some poor health outcomes? Well, it's because the animals don't metabolize the omega-6, and then we eat it. And then we blame the animal instead of blaming the farmer. Or the rancher, maybe that's the correct term.
Or the corporation that owns it.
Or the corporation that's putting pressure on the rancher. That's probably the bigger thing. So depending on the oils and recipe, margarines have different amounts of saturated fat. The more solid the margarine, the more saturated fat it has. Skip the stick and choose the softer liquid margarine. I mean, this is the complete opposite of what we should be telling people. So folks, when you find things on the internet like this, if you don't know how to read scientific literature and connect dots, you're going to be a tool of the industry. I mean, that's it. And then the last line says, limit the amount of margarine you use to limit the calories. So it's the most vague article that you could get to.
This fight against calories.
So now omega-6, now this is from a doctor. A doctor wrote this article. And now, folks, these articles are written in the last year. That one was 2022. This one actually was from a few months ago, okay? This person says, let's see, the body can't make linoleic acid, an essential fatty acid that includes omega-6. A healthy diet is the body's main source of omega-6. So this is accurate based on what we saw, because if you don't have omega-6, you don't have any inflammatory pathways, right? So you gotta have some fat. But it says until more is known, you can keep your heart healthy by limiting saturated fats in your diet. Okay, this article's 3 months old, and we're talking about data that's decades old, and plus that meta-analysis, which we'll post in the description, showing that saturated fat reduces risk of stroke. So Mayo Clinic, you guys are great, but these articles need to be edited. They need to be fixed. So please fix them. Okay.
Do they ever have articles on the...
I'm being a millennial. I'm just staring at my phone now.
Do they ever have articles on the opposite side of argument?
What do you mean?
So saying the omega-6 are not good.
Well, then that would just make them look confused. I didn't find any other ones. Those are the ones that came up. So another interesting thing, and I don't think you guys can see this. It's the linoleic acid pathway to get to arachidonic acid. Those are the main omega-6s. There's an intermediate here called gamma linoleic acid. Gamma linoleic acid has anti-cancer properties. This is in a study I found. And it's an omega-6, it has anti-cancer, but it gets metabolized by elongase, so you would have to inhibit elongase, or you would have to have like a prodrug of gamma linoleic acid that doesn't get metabolized so that it persists around. So maybe that's a therapeutic target to keep the balance.
There might be.
But now, folks, this is kind of the closing point here of our little discussion. I took the liberty to acquire the United States all-cause mortality data from 1900 to 1998, so almost 100 years of data. And then I put it against this little graph that comes from the USDA, 101 years of butter and margarine. Per capita consumption of butter and margarine in pounds per year from 1909 to 2010. So I just made note here of 1914. The cardiovascular death rate was 158 per 100,000. So I think tuberculosis was just getting under control around that time. So there were some years where tuberculosis surpassed. But
Right.
Since about that time, cardiovascular death has been number one. So everybody agrees, cardiovascular death's number one, okay, for cause of death. But the proportion, the relative number changes. Look here, in 1945, am I right? Here we go. And we'll post these. In 1945, cardiovascular deaths went up to 320 per 100,000. So it more than doubled. But look at the graph at that time. See, when it was low, the margarine use was low, the butter use was high. Okay? And then when cardiovascular deaths doubled, butter was
decreasing.
Was almost half the use it was before, and margarine was on the uptrend. Okay? And then that cardiovascular death rate in and I jumped up to 1984 because it's pretty much the same, and then it goes up and down. It stayed up around high 290s. Over here was 303 deaths per 100,000. With margarine shadowing butter now in use. And now there's a very nice little special line right here, this little downward slope in the late 90s. You see the margarine line is going down and butter stayed the same. Margarine use went down. Cardiovascular death rate per 100,000, 262. So,
Why did margarine go down? Do you
well,
know?
I think because I remember when I was growing up in the 90s, I heard that margarine was bad. I think people even then were talking about how bad it is.
And butter is making a comeback.
Butter is now making a comeback. Thankfully, it's making a comeback. So there you have it, folks.
And biggest culprit within margarine is omega-6.
Yeah,
And
omega-6. And folks, we didn't talk about trans fat in here. Trans fat was probably in the margarine, but as of, I don't know how many years ago, margarine's not allowed to have trans fat in it. Trans fat has been outlawed in our country. But a small amount of it is allowed to be in our food, because if you see polyunsaturated fat, partially hydrogenated anything, that's trans.
partially hydrogenated.
Yeah,
anything.
if you see hydrogenated oil, partially hydrogenated oil, that's trans fat,
How is it trans fat?
because it's been hydrogenated. So if you think of organic chemistry, you have a fatty acid chain. Like you have the cis,
Yeah.
so like you have the double bond,
That's
and then you
reactive.
have up and down, and you have up and down. Cis is when the large chains are in one direction, either both down or both up. Trans is when you hydrogenate it, and then the orientation flips, and then you get trans. So it goes from cis to trans fatty acid. And then the trans fatty acid is more stable. So now it's more of a straight line. It's less of a crooked thing. So if it goes in more of a straight line, it can have more order. So it will be more solid at room temperature. And so bakers and cooks and dessert chefs can more easily make and craft things that are more aesthetically pleasing
With the trans.
with the trans fat, at the expense of giving everybody type 2 diabetes and shrinking their testicles. So that's the short of it, folks. The bottom line is eat organic, eat grass-fed, eat wild-caught, eat pasture-raised. Do not settle for anything else. That's it.